and welcome to another episode of the MVOICES podcast. I am your host, Shirat, and today we'll be talking to a person that works in an entity that oftentimes when we hear, we think, oh my goodness, that is unreachable. How do I access such a place? How do I talk to people that work in that space? And that is ministry. Hello and welcome. Could you briefly tell us who you are and what you do?
Thank you. To all those that will be watching this or already watching this, my name is Dr. Jimmy Ochorin Jimmy. I work with the Ministry of Health and as a senior medical officer in the Department of Community Health, but most importantly in the Division of Disability, Rehabilitation and Occupational Health and Safety. Thank you. I'm glad to be here.
Okay. Could you briefly describe your role and how it advances or plays into disability inclusion in health services?
Yeah, my role really is quite broad, but most importantly, I am there together with my colleagues to see that we come up with clear-cut, interventions that answer the national Healthy Policy 3 that answers the National Development Plan 4. This National Health Policy 3 is really, advocating for provision of healthcare services to all Ugandans, leaving no one behind. That means also prioritizing the provision of healthcare services to persons with disabilities. And so my role, together with my colleagues in the department and division, is that we come up with, ideas on how best we should operationalize the National Health Policy 3 through coming up with strategies, guidelines, standards that really are clear-cut to disability inclusion in our healthcare system.
Okay. So there are policies, of course, that always guide or help persons with disability, but also everyone else. They're just those policies that are put in place. What key policies are there that guide disability inclusive healthcare? And where do you think gaps still exist between the policies, the implementation, and even how people understand these policies?
Well, from the broader aspect, I think we all subscribe, as a ministry and the health sector, we all subscribe to the National Health Policy 3, from which the ministry has a broader strategic plan, which all departments have to implement. And the strategic plan has clear-cut, strategic intervention areas. And particularly for our side is provision of disability inclusive healthcare services. And for us to actualize that, we go on to develop. I think we have a strategy, a national rehabilitation and assistive technology strategy, which guides the provision of inclusive healthcare services for persons with disabilities. And then, so it's from that strategy that we have to operationalize it at all levels of care, right from the national level, regional level, districts, including the communities. And what do I mean by that is that at national level, we have the public health facilities, right, starting from all our national level referral hospitals. I know that the public out there could be well conversant with Mulago. So there are other referral facilities at the level of literally close to the level of Mulago at national level. Then from the national level, we have the regional referral hospitals. Currently, we have about 17 regional referral hospitals in all our regions: Ankole, Bugisu, Acholi, Western Nile, Busoga, etc. So all those, we have regional referrals in there. Then from there, we have district hospitals. Yes, so from district hospitals, of course, we have the lower level facilities, health center 3s, 4s, 3 and 2. Then at community level, we have the health center 1, which we know that this is, the focus is around the community health worker. And the community health worker in our setting is a VHT, plus the community health extension workers, whom most have been, trained on the delivery of healthcare services. But of course, we have not, tried to engage the health workers on a larger scale to see that they provide disability inclusive healthcare services. So from the existing, policy that is emphasizing the provision of, universal health coverage, we are operationalizing that, as I've already mentioned, through the existing strategies and policies, and guidelines, to see that we have all the key players in as far as healthcare at all levels get, oriented on how best to offer these disability inclusive services. And so efforts are in place to see that, these levels are able to provide these inclusive healthcare services. Of course, we have cognizant there are existing gaps, without doubt. We are the existing gaps, right from national level up to our various communities. We know that at national level, there's been a chronic existing gap of how best do we integrate these services, both at policy level, effectively planning and designing for the implementation of these services, resource allocation. So these have been, significant challenges, and these have trickled down to the lower levels. And of course, when something is not appropriately done at national level, then there will definitely be challenges at implementation in the lower levels. And so the provision of these inclusive services have been a significant challenge at actual implementation in the various regional referral hospitals, the districts. Yeah, but efforts now are in place to see that we try to mitigate these existing gaps. Of course, there are leadership gaps, human resources gaps, financing, health financing for rehabilitation, disability programming. So amidst that, we are really starting to make sure that we streamline and we integrate disability programming into the healthcare system.
Okay. Yeah. If there is a young person with disability watching this right now, what policy would you recommend them to sort of, understand, read, and comprehend, so that in case something happens, they can always reference to that policy and say, but there is a policy for persons with disability that says A, B, C, D, and this is exactly what I should be expecting from a health center that I am going to just access any service whatsoever.
Yeah. So in terms of, policy-wise for the common person to access, I think we go back to the Persons with Disabilities Act 2020 that has been recently amended. I think currently it's called CAP 115 of the Persons with Disability. It's an act of parliament that really advocates for provision of social services for persons with disabilities, and clearly defines what disability is, what types or categories of disabilities are. So for a common person out there to bring themselves to speed on what disability is, I think that would be a good starting point for them to get to know of the existing Act of Parliament. And then from there, really zeroing it down to the healthcare system. I think them getting to conversant with the existing Ministry of Health strategic plan. I think it's a public document that everybody can access on our ministry website to see what is that the ministry is really pushing and trying to streamline or mainstream to see that disability inclusion is well planned for. And it is very, very clear within our strategic plans of the Ministry of Health that we really want to provide disability inclusive services in our healthcare system. We want through that, we really want to make sure that we equip our existing, assistive technology workshops to see that they are really, really up to standard, to be able to locally produce and distribute or issue assistive technologies to those that may need them, including persons with disabilities. We really want to make sure that we improve our human resources, especially the rehabilitation health professionals that provide rehabilitation services that are really, really very need best for persons with disabilities. We want to make sure that we improve the capacity of our existing human resources, particularly health workers in general, to see that they provide inclusive healthcare services. If a person with disability comes in, walks into a health facility, asking for an HIV test, asking for malaria test, asking for a nutrition assessment, what should our health workers do? So this is what the Ministry of Health is really wanting to achieve in our current strategic plan. It's a 5-year strategic plan, which started this current financial year, to see that we are able to provide these services across all levels of care. So for me, I do think that is the quickest one can really want to, want to do it as far as access to information on what government is trying to put in place.
Okay. Yeah. Thank you for that and for shining light on the Disability Act. Yeah. So in the perspective of ministry, what constitutes a health facility or health center being accessible? But also, how do health workers, just come into the whole play when it comes to being able to assist or provide services to persons with disability?
So I think the ministry has taken a bold strategic shift, close, I think from 2010, to starting with the health infrastructure, to see that as far as accessibility is concerned, all the modern health facilities across board are accessible in terms of reasonable accommodation. The health center 2s, health center 3s, health center 4s, specifically, we know that these facilities are the ones that really see bigger numbers of persons with disabilities, and these are closer to the communities as opposed to the higher level, closer as compared to the secondary and tertiary level facilities. And so, in as far as infrastructure is concerned, I think the ministry has made it very accessible. There's existing ramps across all our healthcare centers, health center 2s, health center 3s and 4s, district hospitals. There is deliberate effort to put handrails, for persons with disabilities that may need to use them in terms of movement from one point to the other within the facilities. We find that within the facilities, the walkways are quite wide. The doors that have been installed into the facilities are quite wide to enable accessibility for someone, for a wheelchair user, for instance, even the visually impaired clients that visit our facilities. There is a deliberate effort to remodel the existing, for instance, areas of conveniency, so that they can be as accommodative as possible for whoever accesses them when they reach. And also including the service delivery component as well. I think we're being very deliberate to see that we improve the knowledge and skill of our health workers on how best they should offer disability inclusive services. For instance, in our maternities, we are trying as much as we can to make sure that we have adjustable delivery beds within our maternities, so that a person with disability who is pregnant comes into a facility and they're going to have a delivery. They should be able, the events around delivery should be as non-eventful as possible. So these are some of the things that we are putting in place to see that our facilities become very reasonable. And most recently, the Ministry of Health, with support from public service, we've been able to integrate sign language interpreters into our public service scheme, to see that these are incorporated in. So it is now upon the health facilities, the administrators, the managers, but also the districts to see that there's sign language interpreters are eventually hired to make sure that there is on communication for the deaf and the hard of hearing to do signage for them. Yeah. So, but of course, there's still existing gaps definitely to see how best we can communicate appropriately. There's lots of new technological advancements that we need to start integrating into our healthcare systems to see that we do not leave anybody behind. But I must say that there is goodwill from, of course, the leadership of the Ministry of Health, but also the political leadership to see that all these, interventions are put in place.
Okay, yeah. You have mentioned something that I have heard so many times about making sure that the beds are accessible for persons with disability. But also speaking of health workers, there's always been conversations around persons with disability being treated a certain way when they go, especially pregnant persons with disability, when they go to access services, they are either, treated a certain way, ridiculed for even being pregnant, which I'd like to believe that everyone has a right to be pregnant if they want to have a child, as long as they can take care of that child, right? But in your opinion, what can be done to address such issues that are still happening, especially with health workers whose mandate is to serve with love and care? But when it comes to persons with disability or a different group of people that they do not feel comfortable with, they then start bringing in views that are very uncalled for. And instead of helping the people, they just end up being a problem that is added to that.
I surely want to, I can't agree no more. When it comes to stigmatization and, misconceptions, myths, within even actually our health workers, I must say it's a well-documented, concern that we are very much aware of from the health workers towards persons with disabilities if they come for to access sexual reproductive health services in our health care system. And this has been a chronic issue. It's not coming just recently. It's been there. And there's been deliberate efforts to see that we try to, mitigate those concerns. And in place, the Ministry of Health went on to develop National Disability Inclusive Healthcare Guide, National Disability Inclusive Healthcare Service Awareness Guidelines, to see that we try to go heads on with some of the barriers that are existing as far as access to healthcare by persons with disabilities in the health facilities is concerned. And one of the key areas the guidelines, tackle is attitudinal barriers by our healthcare workers within our health facilities, to clearly see how best we, engage with the health workers, try to, demystify this feeling that, when you say person with disability, they're not entitled to a particular service in our healthcare system. So these guidelines have been, I must say, approved, and we've started the rollout of these guidelines across the entire country, right from national level, to see that we create awareness amongst our healthcare workers, but most importantly, how best do these healthcare workers engage with persons with disabilities to make sure that they offer them services regardless of what disability they have.
Exactly.
Then secondly is in terms of besides just the guidelines, I think there's ongoing, I think some of the immediate interventions, ongoing in-service training packages, to say that we build the capacity of our healthcare workers on how to handle various categories of disabilities, regardless of the service that they are accessing in our healthcare system. Probably in the intermediate and probably long term is how do we integrate disability inclusion right from the training institutions, so that the healthcare workers, as they go through their training, okay, before they become professionals, there should be deliberate inclusion of disability modules within their training, so that by the time they are getting discharged from their training institutions, they are already educated on how to offer disability inclusion services. Yeah, so in my opinion, I think these are some of the key aspects that we can look at, both short-term, intermediate, and long-term.
Okay, thank you for that, because it definitely is an issue, and it will always continue happening if it is not addressed. You mentioned earlier that you have a plan as ministry, and much as I'm excited about it, I would like to understand how the financial aspect of that is. Do you have a specific budget that you have planned for, and how does the allocation work, as well as when it comes to, with leadership also comes accountability, because people need to see what you're doing, how you're doing it, and is it serving the people that it's supposed to be serving? And so when it also comes to monitoring, how will that work?
Yeah, well, it's not only limited to disability programming or rehabilitation per se. I think health financing in our entire health sector is still a huge challenge. And for services, we know that within the ministry there's a lot of prioritization, of course, depending on the burden where it is, and it makes sense. So the resources, really, in as much as we really want, resources will never be enough.
True.
But there is been efforts, really, at least in the recent years, to see that there's deliberate inclusion or integration of health financing for disability, to see that we're able to resource our national level facilities, regional level facilities, in terms of human resources, to have as many as possible, particularly the rehabilitation workers in our regional referral hospitals, to be able to offer the services. I think that is a significant plus from government, to see that there is deliberate will to hire these rehabilitation workers that offer very specific patient or client-centered care for persons with disabilities, and that is rehabilitation services. The other issue is really, I think there's been effort as well to see that there is local production of assistive technologies. We know that what we are producing is not enough. That is for sure. But at least there has been effort to do so. Local production within the workshops is happening. It's not on large scale for obvious reasons, as I've already mentioned. But there is something that is being done within our facilities to make sure that we are able to produce, for instance, crutches, we are able to fabricate wheelchairs, for persons with disabilities. Yeah, so from government side, I think there is that really effort, and I'm very optimistic that the next couple of years to even get better. Yeah, but also we know that we have within the health development partner space, I think there is also a will to see that they complement what government is already doing, and there is a number of partners that have really starting to open up to see that there is disability inclusion in whatever their budgets are when they come into the country to support the health sector.
Okay. Yeah. Okay. That definitely does shine some light on how that does goes.
Yeah.
So how does the ministry use disability disaggregated data? Because as advocates or as people who like to do activism and advocacy, we who do it as work.
Yeah.
And naturally, there are just advocates out there that understand the importance of data and that we have to do everything following what the data says, what the numbers are saying. So I am pretty sure there are numbers or disaggregated data that speaks on disability. And how is that playing into or how does it inform access to services like sexual reproductive health and rights for persons with disability? And how is that data used with the ministry?
Yeah, I think there has been a significant improvement in as far as our data collection is concerned for disability. I think through our existing health management information systems, we're able to collect data, at least starting with the various disability categories across the entire country. We're able to now triangulate the data and see which facilities are sending in through this data, which districts are sending through in this data, and we are now clearly able to understand where the disability burden is. This is not something that was happening, I must say, probably 5 years ago. And so from the very careful and brilliant leadership of our top leadership of the Ministry of Health, we've been able to make sure that we really get disaggregated data right from the lowest level facilities, and from that it is improved in as far as our planning is concerned. Now our next step really is to make sure, besides just getting to understand what the various disability categories, what are the other existing health needs to a particular individual, you get. So we need to again study our data and see how do we quickly track, for instance, needs as far as sexual reproductive health needs is concerned. How we were able to track needs in as far as malaria services are concerned, nutrition services are concerned. So from what we have, I think we can now start to come up with need-based indicators to see that we are now able to really offer those very particular services to the communities. And this is now where we really come in to empower or ask, stakeholders, how best do we now look at the existing data and say, how do we improve it? Okay, because you and I, if you want to go to the facility, regardless of your disability, because you could be already having a disability, but you are wanting to access another healthcare service, not related to rehabilitation, for instance. Yes. So how do we make sure that your need is
being met?
Absolutely is being met. And so those are now the very key in as far as quality of healthcare services is concerned, that we really now have to look at. And this can't be done by the Ministry of Health alone. We really have to sit down together as key stakeholders within our space to see we interrogate this data and see where is the area of improvement that we need to focus on, so that we become really client or patient centered as far as service delivery is concerned.
Okay.
Yeah.
To anyone who's watching, what would you tell them when it comes to working with ministry? Because very many people get scared when they hear, ministry, I can't work with Ministry of Health. They have too many demands. They will ask for this, that, and that. There's a lot of criteria. But if there's anyone out there that is watching that would like to understand how they can either come and help, or if you are in their city, in their region, how are they able to access, the services that are there? But if it's an organization or an entity or even an individual that would like to work with the ministry, how would they be able to do that?
Well, I think the Ministry of Health is a public institution.
Okay.
And public institution here means that it's welcome to everybody. And the ministry, even in as far as being inclusive, I think the Ministries of Health is quite inclusive to make sure that a person with disability can easily access the facility. I mean the institution. So to start with, I think no one needs any sort of permission or clearance to access the Ministry of Health. That's the thing. That's the first thing I need to clearly mention. And as far as specifically to our services are concerned, I think the Ministry of Health, I think most of the programs are welcome to whoever is willing to come and find out whatever information they want to find out from the Ministry of Health. So just to put it simple to the community members out there is, as far any time that you feel like you really want to interact with the ministry is very much welcome, open to the public, whatever questions they have, to come and visit. But also I need to put it out there that our ministry spokesperson is always readily available. The spokes office is always open to answer to all the queries that the public has as far as service delivery is concerned. Yeah.
Thank you so much for clearing that up as well, because it is a concern for most people.
Yeah.
Thank you so much for joining us for this episode this week, and I hope you have listened to our speaker from Ministry of Health and you have at least grasped something. And if you are a health worker, we thank you for all that you are doing, and we surely do hope that whoever works in a space that is for healthcare, in any sort of healthcare space, you are inclusive and you are accepting of people and are able to serve them diligently, regardless of any backgrounds that anyone might be coming from. Thank you so much for joining us today, and see you next time.